My name is Ashley Clay. I'm a registered dietitian working for Kaiser Permanente in Vallejo, representing SEIU-UHW, which represents 150,000 healthcare workers in California, and representing the SEIU State Council, all who support the passage of SB 993. In 2011, my mother was hospitalized with malnutrition. The oral protein supplement recommended by the dietitian to the physician did not arrive with her meals until 3 days after it was recommended. SB 993 would prevent the delays in providing patient care as opposed to my mother's example. Malnutrition is a very significant concern in hospitals, with 1 in 3 admitted patients having malnutrition upon admission. Malnutrition results in more frequent readmissions and longer hospital stays. This means that providing the right nutrition is as important as prescribing the appropriate medication. As a dietitian, I thoroughly screen and interview patients at risk of malnutrition and collaborate with the team to work toward reversing that malnutrition. Passing of SB 993 would allow me to help the physicians I work with provide efficient and timely patient care. Daily, I receive calls from patients, their families, nurses, and other staff requesting simple clarifications for patient diets, such as snacks, soft foods for those who can't chew very well, and protein supplements. Under existing law, if I made these clarifications myself, my institution is at risk of citation. However, such in my mother's example, the delay to make these simple modifications can be quite significant. I ask for your support in passing SB 993 to provide efficient patient care. Thank you.
Thank you. Other witnesses?
My name is Kelly Scanlon. I'm also a registered dietitian at Kaiser and Vallejo in support of SB 993. Just in the past week, I've had doctors call our ordering system Hell Connect, saying he often doesn't get to our dietitian messages and requests till the end of the day, as he's dealing with more urgent issues in the ICU. Even the next day, I made a request in rounds for a protein supplement, and the doctor agreed and started to order it, but then realizing he didn't want to take the time of the other occupations, he asked me to email him so that way he could get to the request as later in the day, and he sarcastically put it as he would spend the rest of his life trying to get to my request. A good portion of our day as dietitian is spent calling, paging, and tracking down the doctors, and it's painful having to wait hours or sometimes even days for our patients to get approval for adequate nutrition, whether it be an oral supplement for a patient with poor appetite or increasing the grams of protein for a patient newly on dialysis who now needs twice as much. So passing this bill, I think, would allow to help us improve patients' nutrition status immediately with the click of a button rather than having to wait. Thank you.